Our strategy here is containment.
York Region only confirmed its first case earlier this weekend. A woman returning from Iran with her husband and child. She was tested in hospital and has since gone into self-isolation. Now her husband is sick too.
Whilst he accompanied his wife and toddler, he didn't develop any symptoms at all until after arrival in Canada and whilst he was in isolation.
Their son has yet to be tested. Meanwhile, officials are working to determine if anyone else may have been exposed. Wednesday afternoon, the family boarded a number 40 GO bus to the Richmond Hill Centre terminal from Toronto's Pearson International Airport. The bus has since been taken off the road and disinfected.
And now today our focus is on reaching out to the actual passengers on the particular bus.
Attempts to contact those who may have shared flights with the family are also underway.
We would not be as worried about any casual context that may have occurred, right? But this is part and parcel of us still digging in and trying to assess the situation.
Health officials here in York Region don't want people thinking that this virus is circulating within the community. They stress the fact that all these new cases are travel related. Among the other cases, a woman in her 70s who traveled to Egypt last month, and 2 men who had separately traveled to Iran. And while they investigate, York Region health officials have a note of caution for all travelers coming back to Canada.
General advice from the federal agency is that anybody who's come from anywhere internationally should be self-monitoring themselves for signs and symptoms.
He says the main signs and symptoms you need to look out for are a fever, cough, and shortness of breath. Magda Gebre-Selassie, CBC News, Toronto.